I think you need to think particularly about the different dimensions, who the partners are within the system that we need to try and influence and get excited about doing something about tackling obesity. And we also need to make it their problem or our problem. The problem needs to be owned. So I think we've moved from quite a traditional approach in NHS that focuses on weight management and a very service approach. Now that we're in local government, I think there's a massive opportunity to take a different approach because we can influence much more effectively across planning, across transport, across the wider determinants. But one of the key things that we've got in local government is political drive and political leadership. And what we need to think about is how best to enable our political leaders to really try to tackle what is a major public health issue or issue for society, which is childhood obesity and obesity more generally. So one of the things we did in Haringey is it was an idea that actually came from the leader of the council, who was exercised by having no ball game signs in the council estates, because she just felt, as a mother of young children, what was the message we were sending? What were we as a council sending? And that was basically saying children can't play here. And so she made a pledge to, well, she was politically savvy, so she wasn't going to pledge to remove all the no ball game signs, but she said she would review them. And that was enough to spark quite a big controversial debate. What that then did, that led on to us working proactively with Homes for Haringey, with the residents' associations, because what you needed then was to have those conversations and those discussions with the residents to say, well, what are the dynamics? Who wants to keep the signs there? Why is that an issue? Who's the space here for? And so on. And so you then start to see, oh, well, what's the system around these public spaces or spaces within council estates where we want to enable kids to play, and how can we influence and change that? But very importantly, how do we get the debate to enable others to think differently about the issue and to make those changes? So across all of this, we also then had set up an obesity alliance, and again that was very much about trying to enable and facilitate and excite a whole range of partners to do things differently about obesity. And we would help provide some of that stimulus, some of the information, some of the ideas and suggestions. But what we're trying to do is get a broad alliance of many different partners, whether it's schools, whether it's hospital trusts, whether it's the voluntary sector. We've got Spurs, and they all are coming forward and saying, right, okay, we will pledge to do things differently, because collectively we need lots of different pieces to really make an impact. I think the lots of different pieces in the jigsaw is really an important element, and you could do lots of things, but I'd also say what we've learned is find 2 or 3 key areas that you really want to push on, phase it, because it's about getting the debate going. So the no ball game sign led on a year later, following all the pushback and all the debate and all the discussion, to a play weekend. So the more positive, well, let's look at how we encourage children to play and be physically active. So I would say you needed both. You needed to really raise the ante, raise the issue, get people exercised and excited, but also do the positive messaging around that. And again, just getting people who part of the system, whether it's residents, whether it's voluntary sector, with schools, families on streets. We had play streets, and then the council could help facilitate them setting up their play streets.